So, hi, Dr. Mohana Priya, and I'm very privileged and grateful that you agreed to be a part of our webinar, live webinar today. And hello, everyone. It's me, I'm Dr. Jayanti from Kolkata. So, I'm really I generally post on these awareness topics. And just because we have a MDS doctor who is specialist in periodontics, that is relating to the diseases. Perio means relating to the diseases of gums, alveolar bone, and some things in detail, and which all things we should take care upon, be it brushing or be it your. Which is the first sign that suggests ki yeah you're suffering from pyorrhea, etc. So Dr. Mohana, can we go ahead with certain insights from you? Can we ask? No, the camera has turned actually black. Hello? Acha, actually, I just wanted to say in Chennai, this flooding happened. So it was like really dangerous. And I forgot to ask you that how were you after this
Voice is very
floods?
low suddenly.
Okay, hello. My voice is audible. Okay, I'll just remove the AirPods then. Hello, am I audible now?
You're audible, but very less amount.
Okay, let's remove this headphones. So now am I audible, doctor? Am I audible now clearly? I removed the
Now
headphones.
okay.
So,
Now it's fine.
okay, okay, okay. So, doctor, we would like you to tell us, first and foremost, please introduce yourself to us. I've given just a brief introduction of yours. And let me tell you, Dr. Mohana is a very sweet and always she helps me with any kind of things, be it person, be it anything. And she's a very good woman, and I'm really grateful to have her in my life. So, Dr. Mohana, I would like to ask you, please give your introduction, and then we would go ahead with the insight session.
Sure, sure. So I'm basically from Chennai, born and brought up in Chennai. And completed my undergraduation in Ragas Dental College, which is in Chennai, and post graduation in periodontology, that is the gum disease and their treatment aspects, everything. We studied as a specialization in Annamalai University, Chidambaram. And as I was stuck in COVID, that time I started my YouTube channel. And fortunately,
Yeah, I
I
remember all the shots
got
and all, they
introduced
were
to
beautiful.
Dr. Jayanti, and it was very nice. I like her voice especially.
Thank you so
Not
much.
only singing, but also when she speaks, it feels something so positive.
Thank you so much. I feel blessed. So, Dr.
Yeah.
Mohana, first, we would like to know this from you that how do you suggest the term that is said by the normal layman, that is pyorrhea, and how do you do the first diagnosis, or how do you indicate, and how can normal people also indicate that yes, now they should visit to a periodontist right now?
Okay. So the gum diseases are earlier called as pyorrhea when it progresses to the bone, but now the terminology has not is not being used for present condition. So the gum diseases are presently uh, addressed with the name gingivitis, and if the gum disease is progressing into the underlying bone which is supporting the tooth, then we call it as periodontitis. So based on the stage we can have symptoms complaint from the patient. So the patient comes to the clinic with a chief complaint of bleeding gums whenever he or she brushes the teeth, or spontaneously also sometimes when the gum disease is too much, even if they bite on a fruit or a vegetable, they see an evidence of bleeding from their gums. So most of the people are not even bothered about the bleeding from the gums.
Absolutely,
Anywhere in the
absolutely.
body, if the person is getting bleeding, for example, in the face or in the neck or in the hand or in the leg, if they are having bleeding, definitely people will
Mm.
definitely seek doctor's opinion and treatment. But the bleeding from the gums have been neglected by most of the people in the world. So the first sign is the bleeding gums. First sign in the sense we can very well examine with the instrument. When it bleeds, we call it as gingivitis. But the gum disease, if it progresses inside the bone, it leads to food impaction initially. The food goes, especially the fibrous food like chicken, spinach, some fibrous vegetables, goes and stuck
Mm.
in between the tooth. People will come and ask, there is no cavity, doctor, but why the food is getting accumulated in between the tooth? So that is the reason, because the gum disease has progressed and it is eating out the bone around the tooth. In that case, there is a space between the gum and the infected bone. So this space is being occupied by the food whenever they eat, and that is also a symptom wherein the gingivitis is progressing into periodontitis. And if it is not addressed now also, then they will have a mobility of the tooth. Mobility of the tooth is being graded in various terms when it mild, moderate, and severe based on the level of bone loss they have.
Thank
Yes.
you so much, doctor, for such a nice, and I believe our video, when it will be streamed and when it will be published on our site in so nice language, without like using any hi-fi words, but telling it in a simplified language is what all our audience, what all audience needs, be it from India or be it from America or be it from any parts of the nation. So understanding it from the basic cause is what we really need. So thank you so much, doctor, for telling us about mobility, food accumulation, and also about the neglect which is created with regards to the bleeding. So
Yes.
thank you so much, doctor. I would like to ask or have
And
your
and
insights.
also
Yes, yes,
sensitivity
doctor.
will be there when
Mm.
the bone is coming down. The root is exposed. The
Mm.
root of the tooth is exposed, and whenever the patient drinks water with various temperature, either it may be cold or hot, they couldn't bear that temperature change, and they will have extreme sensitivity. So the gum disease is also a reason for sensitivity. There are various reasons for dentinal hypersensitivity,
Mm.
but it can be due to the cavity, or it may be due to the gum disease, or it may be due to the faulty tooth brushing. But the sensitivity is also a symptom for the periodontal, the gum disease. In addition, the gum may recede. The gum will not be in the normal position. It may come down gradually if the debris, plaque, and deposit around the tooth is not being treated. Then this will induce the inflammation, which we call as
Information.
the whenever
On
something hurtful
information.
happens, whenever the foreign body is there in a body, the body
Mm.
itself will reject it.
Produces the
So in that
antibodies.
inflammatory host response, the body
Mm.
itself is
Absolutely,
trying to
absolutely.
destroy the bacteria. But in addition, due to this host response, there
Mm.
is a destruction of the bone around the tooth also. Though the body's nature is trying to destroy the bacteria, parallelly, due to the immunity, the host response, the bone is also destroying around the tooth, which, if it is not addressed in the initial stage, then it will ultimately lead to the tooth loss.
Thank you so much, doctor, for telling us even the like consequences which are very severe, not only with regards to bone loss, mobility, tooth loss, but also the severe inflammation induced by the host defense reactions. And
Yes.
the immunity is very important, which we need to take care on. Whenever it gets hampered, we can develop any kind of severe inflammation, etc. So thank you, doctor, for this very nice and a good information. So I move on to the next insight which I needed from you. It was with regards to like the instrument. So actually, this question, we knew that we are creating this awareness for public. But actually, one of our juniors who is into perio second year from our college in Jharkhand, he told me to
Okay.
ask you this, like because he's very interested and he really loves your videos, all the videos since the start. Your videos which were there, not only with regards to deformative gingivitis, instrumentation, but everything.
Yeah.
So, doctor,
Okay.
like, which is the normal or first instrument or different kinds of instruments which must be there in the kit, or which is the main one for the diagnosis of these pockets or bone recession, gingival recession, etc., or mobility, or yes.
So it's very saddened to know only the clinic who is uh, a periodontist are having periodontal probe in their clinic. Most
Yes.
of the people, when I'm going for consultation, not for the procedure as
Mm.
such, just for the
Mm.
consultation, I may ask them, can I have a periodontal probe? They say like, ma'am, I only have a straight probe. I don't have a periodontal probe. So this is one of the basic armamentarium that should be there in every clinic, because even a general dentist can um, uh, measure the amount of the gum disease, whether it is restricted to the gingiva or it has been going deep into the bone. So
Absolutely.
they are, as you know, they are markings in the probe. So you can analyze how much of bone has been lost. In addition, the tip of the probe is blunt in a periodontal probe. It's not sharp as you see in an explorer
Mm.
or a normal probe. So the
Absolutely.
patient will also feel comfortable when you measure the bone loss with the periodontal probe rather than with a straight probe.
Absolutely. Absolutely,
And
doctor.
also, one more armamentarium, if they can buy, would be a neighbor's probe, which was used to find whether the patient is having a furcation bone loss. So that is also, but even if
Mm.
you don't have a neighbor's probe, no problem. But the periodontal probe, the Williams probe, has to
Williamson.
be there in each and every clinic.
Thank you so much, doctor, for this question. I'm sure our junior who is watching this or who may watch after submission of his dissertation or thesis. So, through this question, I remember the next insight which he needed from you is which topic can be a good one. You know, for the library, we generally had in our college days, that is two things. That is, one is library dissertation LD and the thesis after third year of submission, like after third
Okay.
years of PG curriculum. So,
Okay.
if you suggest, like I know telling it openly is very tough, but even if you give certain like broad areas, so he
Mm.
will surely focus on that parts as well. Not only he or maybe his entire batch. So, yes, doctor, we needed to know the
So
topics.
the dissertation, the main dissertation should not be a broader topic. For example, for example, library dissertation you're asking, right?
Yes, yes,
Library
yes.
dissertation. Don't take a for example, if you see uh, suture, you take
Mm.
suture, it is very,
Yes.
very vast topic.
Mm.
So you have
Absolutely.
to restrict to one particular suture
Mm.
material and do a library dissertation in detail about the that particular area. If you take a broader topic, then
Mm.
it will be like you have not uh, covered it properly. At the end of dissertation, you
Mm.
may feel like you have just come across the outline, rather you didn't go to the depth of the
Mm.
uh, things. In
Yes,
addition,
yes.
if it comes to the main dissertation, I always believe anything we study, anything we learn has to be useful for the public.
Absolutely. Clinically, yeah, very
So
good.
clinically. So when I was doing my post graduation, along with me, including me, six people were there, six friends were there, and among the six, I was the only one to do the clinical main dissertation. Everyone were being sticking on to the biomedical, biochemical type of
Mm.
dissertation.
Like a
Though
prevalence
it is
study.
tough,
Mhm.
Yeah, though it is tough because people are very scared to take the
Cases.
legal type of recitation. They are scared whether
Mm.
the 1 minute.
Yes, yes, sure, doctor.
Sorry.
Yeah, doctor. Actually, yeah, network issues are also there in our side as well, actually. Yes,
Okay,
doctor,
so
you may go
due to
ahead.
noise problem, Wi-Fi just dropped down. So,
Okay, no problem.
the main dissertation, people should be very courageous enough to take the clinical side of dissertation because it gives you indirectly the patient handling. Also, it will be indirectly, it will be helpful for your whole life of professional life. So
Absolutely.
they are like, why the PGs are reluctant to take the uh, clinical subject. They are willing to take the biochemical is that if they want to be in contact with the patient once, they are not sure whether the patient will turn back for the review, for the 3 months
Okay.
review, 6 months
Follow up.
review,
Yeah,
1 year review. They are very reluctant. If you are
absolutely.
very much in good relationship with the rapport with the patient will definitely turn back to you even you call them 5 years later. For
Yes.
example, yesterday, day before yesterday, I got a call from a patient. uh, Her husband called me. I'm Swa's husband. Ma'am, I did treatment in your Chidambaram college. Are you still available there?
Yeah, same thing. It happened with me like the last week. Are you there in Awadh? We would like the crown which you fixed. I want the crown on the opponent, like next side, opposite side.
Okay.
So I said I've
Okay.
left my college in 2020. It's been long that I left my college. So you can ask my juniors, or I gave him the thing as you said, moderator's number.
So
So it
then
is
I
very
told
good
like I'm not
memories.
available, but you can come to Chennai if you want to be treated by me, or if it is not possible, I will redirect to my professors your number. They will definitely take care in a very great manner.
Absolutely, absolutely.
Uh, So,
Yes, yes.
coming to the topic, that's why we have to take clinical
Mm.
subjects, according to me.
Mm.
So that
Absolutely.
would be useful for their whole professional life.
Wholesome. Thank you. Thank you so much, doctor. So really lovely the way you are correlating your clinic like your normal, like the way the patients relate with you, and how important it is, that is to maintain a cordial relation, a mutual relation, not only be it patients but with every person we speak to, have a humbleness and be grounded. So thank you, doctor, for going through the life lessons as well, not only along with these clinical things. So how important it is to maintain periodontal health in children, doctor?
Children. So children, the periodontal health starts as soon as they are born. Okay, they don't have a periodontium as such, but they have gum
Hmm.
pads. As you
Hmm.
have mentioned in the earlier live, it has to be wiped
Great.
off and things. But it is even more related before even they are born. The pregnant women, if they are having a gum disease, it has a huge impact on the babies. They will have a low birth weight babies if the periodontal condition is not in a healthy manner. If it is disease, if the periodontal disease, the gum disease is severe, then this will pass on to the bloodstream and it will reach the uterus and it will induce the uterine contraction, which will lead to preterm birth before even
Hmm.
39 weeks is reached, the 32nd week or 31st week, 30th week also, the women would experience a preterm labor if they are not maintaining the gum health properly. In addition, there are studies justifying that if the pregnant woman is having a gum disease, then the birth weight of the baby is less. That is less than 2.5 kg. They are prone. So that much important is there even before the baby is born. So as it's not like for the baby and for the adults, irrespective of the age, the periodontal disease has a huge impact on general health. For example, study says that if there is a periodontal disease or the gum disease, if it is not being treated, then it will reach the bloodstream and the bacteria from the mouth will reach and sit on the heart valves, heart inner
Hmm.
lining, and it will
Mm.
lead to uh, myocardial infarction that we call it as heart attack.
Okay.
Okay, and also
Absolutely.
the secondly, the periodontal disease, the gum disease is related to the diabetes. There are two-way relationship
Mm.
between the
Gum
gum
disease.
disease and the diabetes. So if a person is having a gum disease and also he is a diabetic, the glycemic control will not be under control. It will not be within the normal range. It may shoot up due to the gum disease because of the periodontal disease. In the similar manner, if the patient is having an uncontrolled diabetes, it will destroy the bone around the tooth. So it is a two-way sword. So
Bidirectional
it
relation.
has to
Yes,
be,
yes.
yeah, bi-directional relationship. In addition, there are studies saying that people who have been hospitalized are having respiratory disease. They are more prone for pneumonia, the hospital acquired pneumonia,
Yes,
if
yes.
they are having a periodontal disease. And
Hospital
also,
acquired
person who are
pneumonia.
experiencing the joint pain, the rheumatoid arthritis, they are
Mm.
also the periodontal disease has been one of
Mm.
the reasons for that. If the periodontal
Absolutely.
disease has been treated, they have a huge improvement in the rheumatoid arthritis cases.
Yes, yes. Yes, doctor, absolutely. The way you said about hospital acquired pneumonia, my mother, I can relate it very personally because my mother went to her hometown, like
Mhm.
for one of our relatives' health, and in the hospital only she developed this chronic illness, hospital acquired pneumonia, due to which we had her vaccine like few weeks ago. And yes, immunity does play a role because she's a borderline diabetic patient. And that's what you said. Even in case of
Yeah, it's like
immunocompromised.
pneumonia, yeah,
Hmm.
immunocompromised, and also this not due to. I'm not saying the periodontal disease caused hospital-acquired pneumonia. I'm not saying like that. The
But one of the
respiratory
consequences.
diseases,
Hmm.
yeah, respiratory disease
Hmm.
due to the inhalation, this
Hmm.
ingestion into the respiratory tract, all the
Hmm.
inflammatory byproducts will
Hmm.
ultimately lead to respiratory diseases also.
Absolutely, absolutely. Thank you so much, doctor, for this very, very awareness creating topic that is which is very general and very common in this cold weather as well. That is the hospital for any relative if we go hospital acquired infection or rheumatoid arthritis, if there is an immunity related disorder, be it multiple sclerosis as well. But we need to see all these and because every disorder where immunity is involved, there can be a gum related infection. There can be bone loss, mobility, tooth becoming very much mobile, etc. So, thank you, doctor.
I, yeah.
Yeah, yeah, yeah,
I would
please,
like to
please.
add upon one thing in this juncture. Like the gum disease in the pregnancy. So this has to be prevented. So before
Hmm.
even you are
Very
getting married,
important.
the people has to go for a complete oral health checkup,
Health
and
checkup.
if needed,
Yes.
appropriate treatment has to be done before even you are
Hmm.
getting married.
Absolutely.
One more thing. You would have seen a lot of people who are mentally retarded,
Hmm.
spinal cord the neural development has not been proper in certain children. So that
Hmm.
is mostly due to the folic acid deficiency in the
Folic
pregnant
acid.
women. So we
Hmm.
always recommend to start the in abroad and all, they used to take the folic acid as soon as they attain menstruation, first
Menstruation. Yeah.
menarche. So, but
Absolutely.
now at least we have to take 3 months prior to the marriage. 3 months prior to the marriage, we have to start the folic acid so that the folic acid level will be there in the blood in a normal range, so that whenever you get pregnant, the folic acid will be in sufficient amount. For example, people are
Hmm.
taking folic acid after they know that they are pregnant. The
Yes. Yes.
disadvantage is that by the eighth week, you know that you are pregnant. By the time 70% of the neural development is over in the
Hmm.
fetus. So this
Absolutely.
so you have to take it even before. So the
Yes.
one more thing I just wanted to add is that if you want to give something, you may think what you have to give for the couple. A strip
Hmm.
of folic acid has to be gifted to the
Yes. Yes.
couples. So
Yes, a very good one.
that may create an awareness why
Awareness.
this person has gifted this. In that
Yes,
manner, they
yes.
can Google also why they gifted folic
Hmm.
acid in
And
marriage. So
everybody
that
does that. And everyone would want that no retardation or any kind of specially able children should be like there, because it's a like stigmatizing thing not only for the children but also for the parents. So everybody would want it, as you said, from the like starting period only, or be it like from the ladies who are have reached their
reproductive
menstruation,
age.
yeah, menarche or premarital age, childbearing age. So they can, since that age only, they can
Completely.
start ahead with folic acid tablets specifically, even if they are not taking B complex or A to Z, etc. But folic acid. Thank you so much, doctor, for this very, very good feedback, and being on the side that you are also a woman. So understanding the problems and explaining it to the mass, leveraging it to the mass. From the woman's perspective is what we need, and it's what India needs today. So thank you,
Yes.
Dr. Mohana. And I move on to the next insight. I must say that you are really bearing me since long. I'm just asking you like as if I'm a media reporter, and I'm asking uh, an actress like you play. And yes, you are very beautiful, and I feel like asking you throughout like uh, what more I can ask you to gain knowledge or to gain such important feedbacks, which I'm sure if somebody watches, many people would watch our video after the sharing and all. So knowing many people, I'm sure they don't know, even after being maybe a dentist or maybe a specialized dentist, many people don't know these facts which you have told in this 1 hour of session. So I wanted to have this insight also, that is how important it is, doctor, to have an awareness on scaling. And is it like scaling, or people call it by other names like cleaning and various names they call? So how important is this scaling? And is bleaching that very dangerous or very harmful? And can you please tell us, like in brief, how to like your insights we would like to get on this.
Scaling is a simple procedure to remove the plaque and as well as the calcified plaque that we call as tartar in layman
Tartar.
term, deposit.
Mm.
Professionally, we call it as calculus. But by
Calculus.
the layman term, the hardened deposit cannot be removed by your normal home oral care measures. Like toothbrushing will not be able to remove that hard deposit. So if you are maintaining everything well, then
Mm.
there is no need of scaling. We always insist 6 months review, but we don't say like 6 months once you have to do scaling. No, not necessary.
Absolutely.
If you are maintaining to the mark 100% very well, there is no need of scaling 6 months once. In the addition, there was a stigma like when you do scaling, they lose tooth structure, the tooth is getting mobile. These are the stigma they have.
Mm.
Tooth, because they, as you know, we are in the same field, like they are separate instrumentation for the scaling. There is a separate instrumentation for the cavity preparation to drill on the enamel to reach the layers of teeth. But people think that the ultrasonic instrument, the instrument which we use for
Yes,
cleaning the tartar, will remove the enamel. It will never. Otherwise, we use the same. We can use that instrument for doing a cavity preparation, right?
yes,
So we
yes,
have separate instrument for each and every procedure in dentistry. So don't get panic that the cleaning the teeth will not will not will not remove your enamel. So, okay. So
yes,
after
yes,
cleaning, it is always advisable to do a polishing so that you get a smooth surface, smooth glossy surface, so it doesn't attract more plaque to that place. That is the only thing you have to do. Scaling and polishing is compulsory.
compulsory.
And
Yes.
apart from that, you ask bleaching whether it will have an impact. So
Mm.
bleaching can be done as you it has to be done periodically. It is not a one time solution like a crown. It has to be done now and it has to be done after a few months.
Mm.
But
Mm.
if you are doing, there are studies saying that it may lead to cervical resorption. That is like the loss of tooth structure in the neck of the tooth, but it has not been proved. But there are studies saying that it may
Hmm.
cause sensitivity due to
Yes, yes.
cervical disruption.
Severe acids are
Uh,
used, so I feel it's very damaging. Any kind of bleach, be it bleaching people do for face or people do for any clothes also, and this is a part of our oral cavity. So I feel, as you said, doctor, I also personally feel, even though I don't have any records or prevalent study, but retrospective analysis does tell that yes, they because they contain severe acids like sulfuric acid or various acids, they do have an impact. Maybe they can show temporary whitening, sparkling white, etc. But long
Once
term,
in a while is okay. Once in a while is
mm,
okay. Too
okay, yeah,
much, you are doing very
mm,
continuously, then it is not
yeah,
advisable. In that case, if
absolutely.
you want a brighter smile for long term, then you can go for veneers rather than opting
Yes,
for
yeah,
bleaching.
bleaching,
So veneers
absolutely.
would give a permanent resolution when a person is
Yes,
demanding a brighter, whiter smile.
yes, doctor. Thank you so much for this feedback as well. So I wanted to ask you, like recently, I have seen certain articles coming up in various journals, like in South Asian Academy of Pediatric Dentistry or American Academy of Pediatric Dentistry about this stem cell therapy, like stem
Okay.
cells. I'm telling this a bit now. I'm telling it in a bit technicalities because this was one of the asked things from one of our again the juniors from the college in which we did our undergraduate. So they said how good and how good is this topic as well if we go on with some presentation in conferences about stem cell or tissue engineering, etc.
So the stem cell are in the it's now emerging. It cannot. It is not been into the uh, human. Uh, there are human trials going on, but it is not into the market as such. So
Mm-hmm.
it's emerging field of periodontics. If it is so, then it will have a huge impact in dentistry, not only in periodontics, even in endo.
Yes,
There is no need of doing
yes,
pulpotomy.
yes.
They can regenerate by
Yes,
itself. Everything,
regenerate cells. They remove the necrosis can be removed just by
and
a
then
stone excavator, and the cells can be regenerated, like
yeah,
just
yeah.
like the reparative dentine, na doctor? Like it forms
So it is not
remineralization.
presently into a human use, but a
Hmm.
lot of trials are going
Yeah,
animal and
yeah. Very expensive also. I feel if they come into market, they will be very expensive also. And in India, we need to take on the pocket concern. So if I will say, if any junior, if you want to make a presentation on this topic, you can try it out in certain out of Indian conferences, because in India we mostly see the socioeconomic status. We want our patients to have a good follow up, and they should not think that the dentist is just like providing a bridge or causing an obstruction, like causing certain problems in their pocket, like that is
use also
taking
there.
all their
But
hard earned
if it
money.
comes for the human use, it's well and good.
It can be good.
Always very nice. But
Hmm.
I feel like whatever advancement is there, or whatever advancement. For example, earlier the television was not there. Now the television,
Hmm.
even in a very poorer people, they are having. That is the advancement we need in the society.
Hmm.
One group
Yes,
of people are accessible for that, and other
yes,
group of people is not accessible for that. Then that is not the
yes.
growth in the
We
society.
need
So all
absolutely
the people should be able
benefiting.
to access that any particular
Hmm.
advancement it happens. It has to
Absolutely.
be accessible to everyone.
Every
So
section of
earlier,
it. Hmm.
yeah, so cell phone were not being used for by everyone. So in a similar
Hmm.
manner, even some new advancement come into dentistry, it is to be made sure that all cadres of people has to be they should be accessible for that.
Yes,
That is
yes,
the
yes, absolutely. And I really love this line of yours that like very few dentists do say it over a large leveraging social platform. But I feel the way you said, this makes me remember one line that if you're honest and if you're telling something very true, transparent, it should you shouldn't fear anybody, because the lines which you said, like it should be available to all sections of our society. Recently, we see in most of the conferences, big doctors very tell about expensive instruments, expensive loops, or be it expensive medications. But the point to which we need to look upon is it must be accessible to all sections of society. Unlike
Yes.
the Titanic leverage which was given, that the lower class, they stayed up on the Titanic and they died, but just the higher class and the upper middle class survived. So it should not be like that. I feel it. And yes, and as you said, doctor, very true. So, doctor, is there any impact of stress on oral health? Because I'm telling it from my perspective also. I am also a very anxious and a very stressful person, and I stress at small, small things. So, how does it impact?
So stress will induce the inflammatory cytokines in the body. So it is like an insult. It's like a chemical insult or physical insult. Any insult in the body will induce these cytokines, the pro-inflammatory cytokines, which will induce the inflammation. So the inflammation will ultimately lead to the periodontal destruction. But
Yes,
only
yes.
thing the periodontal destruction is that in certain cases only
Hmm.
the inflammation plays a role. Only
Hmm.
one and only inflammation is not only the role. The
Hmm.
plaque and the bacteria should be there. In addition, if you have a stress, then it will synergize and have a greater destruction. You have a very clean mouth, you have stress, it will not be so much of destruction. If you
Yes,
have
yes,
a poor oral health, in addition you have stress, then there is a problem. You have poor
yes,
oral health, you have diabetic, but if a person is having diabetes, it doesn't mean they should have a periodontal disease.
yes,
If the person is not maintaining the oral health, in addition they
absolutely.
have diabetes, then it goes wrong.
Yes, yes, doctor. Actually, I remembered one certain thing in my college days when we were taking IOPAR, that is the X-rays, intraoral X-rays for each of our teeth, that is our dental X-rays. One of my colleagues said, "Are you don't have dental caries in any of your teeth? Are you brush twice? Because we brush once." So,
Okay.
as you said it very perfectly, that's where I wanted to give a high five to you. That is, it's always not necessary that if you are stressful or if you have diabetes, for sure you will have periodontal disease. Everything depends on your self discipline also, whether you are maintaining oral hygiene or not. So thank you,
Yes.
doctor. And so I would also like to ask you, like, about this thing that is, as you told in the start about the bone loss. So, how severe can the bone loss be in a patient if the patient is young? And how can it affect the look of the patient? And when should the patient visit to the periodontist uh, uh, for the early signs of this bone loss? Like, how to detect that? We know X-rays help us, but for the part of the patient, for a proper self-evaluation, what shall we do?
So bleeding gums, again the first sign. Whether
Yes.
it is even if it is not restricting to the gums, it is gone deeper. That time also bleeding gums will be there. In addition, they will have sensitivity because the root
Hmm.
surface has been exposed due to the bone loss. They may have a gum receding from the normal position. They may see the root exposed outside. They will have food impaction even though they don't have cavity. They may have
Yes.
space in between the tooth. They put a toothpick and see. That is also a reason for that is also saying that you have a bone loss, but they don't have cavity. In addition,
Yes.
they will have mobility, mild mobility that will not be noticeable by themselves. But in moderate and severe cases, definitely they will know that the tooth is moving. In that time, also we can address it with there are various treatment options to save the tooth without
Yes.
progressing. More and more of mobility can be stopped by treating the
Yes.
periodontal
Very
disease.
don't. Thank you, doctor. Thank you so much. So, like getting your bone defect or bone loss treated as soon. So, is there any best antibiotic, or is there any antibiotic for your choice for treating these periodontal diseases, as per your the cases or consultations you do?
Okay, since it is a broader spectrum of people watching, not only the
Yes,
doctors, so
yes,
we
yes.
can't reveal just like that the name they will
Ah,
go and give
absolutely,
it.
absolutely.
So so the medication are available, but
Hmm.
always the mechanical cleaning has to be
Clean,
done. For example, if it is a gingivitis, taking medication alone will not
not
stop
him.
the disease. So you have to remove the cause by removing the tartar. And if it is a bone reaching one, like periodontal
Hmm.
disease, then you have to remove the granulation tissue, then you have to remove the altered cementum, then you have to remove the pocket lining, then you give antibiotic, then it works.
Then will be far
Giving
at the
only
last. Yeah,
antibiotic doesn't work. It
will
is
not.
going to mask the symptom, but the disease is progressing inside.
But prolonged symptoms will remain. Thank you. Thank you so much, doctor, for this awareness. And it's like brushing up ourselves also with such good knowledge and such good sessions. So, thank you so much, doctor, for all the feedbacks which we got from you, and that too after your hectic schedule. And I feel that gaining such knowledge, even though we are far apart, but this social platform, such a good platform that is YouTube, can connect two of us together and thereby have a good life, that is creation of an awareness, and not
Yes.
only with regards to period, be it gum disease, bone disease, but also the severe consequences and what all screening or preventive techniques can be done to protect the tooth or the bone at an early stage. So thank you, doctor, and I'm sure we will meet again for a session on YouTube back, and we'll have an interesting session with one another.
Sure,
So,
sure.
and a very good night, doctor. Thank you so
Good
much.
night. Thank you so much for the opportunity. Thank you.
My
Have a
pleasure. You
okay,
too.
Ma.
Good night.
Thank you.
Good
Thank you
night.
so much. Bye. Take care.
Bye. You too. Like how to save it?
You can just leave the stream first, and
Okay.
then it will ask whether to save it.
Okay.
The
Okay. I'll do
cross
it.
on the top left
Cross.
hand,
Okay.
you
Okay.
can
I'll do that.
leave it, and then it will ask whether to delete or it has to be uploaded.
Acha. Your stream will immediately stop and you and your guest will no longer be live. End. So I'll do it now.
End.
Okay. Okay.